Are there endoscopic procedures and radiology tests that help to diagnose and describe Crohn's disease? Yes, there are. Allowed only one test to evaluate Crohn's disease, I'm going to choose a colonoscopy. Not only does it give good visualization of the colon, but we can often reach into the last part of the small bowel called the terminal ileum. Crohn's disease is often active in this section of the small bowel, and so getting biopsies of the terminal ileum can be very helpful to describe the severity and the extent of Crohn's disease. Because Crohn's disease can infect the entire GI tract from the mouth to the anus, an upper endoscopy is often helpful to evaluate the esophagus, the stomach, and the first portion of the small bowel when there are symptoms that suggest that a patient may have active Crohn's disease in these areas. Endoscopy is not only helpful to diagnose Crohn's disease, it can be useful to follow its disease course. Patients may often feel better, but when we perform a repeat colonoscopy, we discover that they have active ongoing inflammation. So it's extremely helpful to get a direct view of what the colon mucosa looks like and take biopsies to see how active the Crohn's disease is. Radiology tests are useful to evaluate the unique aspects of Crohn's disease, like fistulas, strictures, and its involvement in deep parts of the small bowel that can be difficult to reach with conventional endoscopy. I generally prefer to perform an MRI because it's non-radiating, and a patient with IBD is expected to have multiple radiology tests over their lifetime, so avoiding radiation when we can is really important. An MR enterography is a specialized form of an MRI that uses contrast to help enhance the small bowel, and it's a very effective means to describe if there's active Crohn's disease in those parts of the small bowel that endoscopy cannot reach. An MRI of the abdomen and pelvis is my preferred test to evaluate a patient with fistulas because they can help both describe where the fistula starts and where it ends, a detail I cannot see with a colonoscopy. If a patient has symptoms that suggest that they have fistulizing disease around the anus, then I'll focus the MRI on the pelvis to give excellent detail about the anatomy of the fistulas in that region. Data suggests that MRI may be superior to CT for identifying strictures. An MRI can help distinguish a stricture that's due to inflammation from one that's the result of scar, and that has important impact on how we manage it in the clinic. What if MRI is not readily available? What are other options? Well, CT enterography is a much faster exam, and that may be the preferred test in a situation where a patient's not going to be able to stand still long enough for the prolonged exam of an MRI. Another option is a series of x-rays taken over time that monitors the passage of a contrast liquid through the small bowel, and this can help to determine if there's areas that are narrowed which may need to be acted upon. A capsule endoscopy involves swallowing a pill that's embedded with cameras which travels the entire length of the GI tract. It can give an extended view of the small bowel deep into areas that conventional endoscopy can't reach. It can be very helpful, but it has to be considered that if a patient has strictures, that pill camera could get caught up, a risk that we have to weigh when performing this test. Using colonoscopy with these other tests can help provide a full picture of where Crohn's disease is active within the GI tract and the complications that it's causing. In addition to these procedures and imaging, lab tests can be helpful to evaluate the activity of Crohn's disease, which I'll discuss in a separate video. Please subscribe to the channel to be alerted to new content. Thank you for your time watching and be safe.